So this is just a video to make autism DSM-5 criteria. Hi guys, hi everyone. I just made this video to make sure I share my experience of remembering DSM-5 criteria for autism spectrum disorders, and I have created this is my experience. This is just sharing how I just remembered DSM-5 criteria for autism spectrum disorder. I just created a nice picture as well. So this autism spectrum disorder, these days they ask for 4 different criterias, and yeah, you can remember with me. Come, we can see together. So the first criteria they are asking is like the person who is the patient or the child, whoever it is, will be lacking of social communication and interaction. So that is the first criteria. The child will be lacking of social interaction and communication. So if you see there, the child is sitting there, he has no social reciprocity. That is the first one under the first point under the first criteria, and he has he is unable to produce any non-verbal communication methods or communication forms, or else he is not able to make any or create any relationships. So that is the first point. So this child sitting there to himself, because he can't make any relationship, he can't talk, he doesn't have social reciprocity, and he is also doesn't even look at them, try to make any body languages or anything. So non-verbal communication also not there, even though he is lacking of all those things. The second thing is his table. He's just fixed to his table. So the second criteria is restricted, repetitive pattern of behavior or interest, activities which can be manifested by the following points. So we can come from the bottom to up. He's very focused. He's not going to turn even if you call. So that's one point. So restricted to his activity, and immense amount of focus on that activity, and hypo or hyperreactivity to the environmental stimulus. So he's not turning back. And the next 2 points are a little bit tricky. So ritualized patterns. So what is ritualized patterns means? He really want to do his things again and again. He doesn't want to change those things. So those ritualized patterns can be verbal or non-verbal, or can be anything. So they will resist to change as well. So this is the ritualized patterns. And stereotypes. Stereotypes also can be there. He will be having repetitive speech, motor movements, and use of objects will be there. So that is the second criteria. The third one is he's a child, so this should present in the early childhood, not later. And symptoms together limit or impair their everyday functioning. So that is the fourth one. So comparing all these criteria, we come to a diagnosis of autism. I just share this picture. So this is how I remembered autism spectrum disorder DSM-5 criteria. So just to share with you guys, always I remember through pictures. That is the easy way to remember, and yes, that is practical as well. So yeah, thank you so much.